Swati?
Hello and welcome everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own tumor tamer, Dr. Krishnamani, to spread awareness about cancer and help patients and caregivers to access the right treatment at the right time. While cancer therapies have advanced significantly, nausea and vomiting can still impact patients' quality of life, treatment adherence, and overall well being. Therefore, in this session, we'll break down why this happens and, more importantly, what can be done to prevent and manage it. So, today's topic is going to be on chemotherapy induced nausea and vomiting. Let me begin by introducing our doctor to you. Dr. Krishnamani has been associated with AOI hospitals here in Hyderabad since the past decade. He has continually expanded his knowledge and skills by completing fellowships from prestigious international institutions. Throughout his career, he has been an integral part of various hospitals and organizations across India, earning recognition as one of the country's leading medical oncologists. He has served on the advisory board for clinical research. His commitment to advancing the field of oncology is further demonstrated by his membership in American and European oncology societies. Welcome to you, sir.
Hello and welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. And today, let's discuss about a very common and important topic, especially from a patient point of view, which we call CINV, that is chemotherapy-induced nausea and vomiting.
So, sir, can you begin by explaining the term? What is nausea? What is vomiting?
Vomiting is you throw out the contents. You bring out contents or food, okay, which so basically the stomach contents, you bring it out through the mouth. That is vomiting. Nausea is a feeling of vomiting. Okay, so CINV is chemotherapy induced nausea and vomiting. So chemotherapy, which induces nausea, vomiting. So chemo drugs are very powerful drugs. They can act on your brain, release certain chemicals, and which because of which you vomit. So on one hand, the chemotherapy goes into your blood to kill the cancer or to control the cancer, but it has side effects, many side effects like hair loss, like fall in hemoglobin, fall in WBC. Apart from that, one important side effect is it also triggers chemicals in your brain which causes you to vomit. And it's a very unpleasant sensation. Imagine you're vomiting constantly, 5 times a day, 10 times a day. It is so unpleasant, right? So you're taking a drug and it is causing such a bad side effect. That is the chemotherapy related or chemotherapy induced nausea and vomiting.
Can you explain it to us in a better way? Like, what is the mechanism because of which it happens?
See, the drug goes and in the brain, there is something called a chemotherapy trigger zone. We call it CTZ. So that area is triggered and certain chemicals like cytokines or serotonins, these chemicals are released into the bloodstream. And once they are released into the bloodstream, there is a tendency to vomit. So the drug is acting and releasing certain chemicals which induces vomiting in the individual.
Are there any specific types of CINV which are present?
Not so. If you talk on CINV, you can classify drugs like highly emetogenic. Emesis means vomiting in medicine. So a drug which is highly emetogenic, which can cause a lot of vomiting, highly emetogenic. A drug which is moderately emetogenic. A drug which is weakly emetogenic. A drug which is very weakly emetogenic. That is what is the tendency of a drug to produce vomiting. So AC in breast cancer, adriamycin, A for adriamycin, C for cyclophosphamide. Highly emetogenic regimen. EC, epirubicin cyclophosphamide in breast cancer, highly emetogenic. That is, if you just give this drug without precautions or without anti-vomiting medicines, 100% the patients will vomit. That much chance it has got. Very low hematogenic is your monoclonal antibodies, trastuzumab used in breast cancer, rituximab used in lymphomas. They don't cause vomiting at all or have a very, very low risk of causing vomiting. Then there are certain drugs. So you classify drugs. So types of CINV means um, one is based on the classification, whether it is a highly hematogenic regimen, moderately hematogenic, minimally, or very low. Another way of segregating it is immediate CINV, acute and chronic. Immediate means while the medicines are going on, patients have vomiting. Acute is which happens in the first 3 to 7 days, and beyond that is chronic.
So typically, when does a patient start to experience these symptoms? You said during the treatment. Like if the chemotherapy has just gone into the patient, will they just start having those symptoms?
So you should understand something. Now imagine you have been to a place once. Sometimes we have heard this, right? This is a very nauseating place. Have you heard this term?
Yes.
It was a very nauseating feeling to go there. So imagine you go to a dump yard. Are you very happy?
No.
You go to a place where all dump and dirt and garbage is put. You are dressed well, good perfume, you are tip top. You go to that place. Doesn't it trigger that nausea and vomiting for you?
Yes.
Great. Now, that is because of that place you are having that tendency to vomit. Great. Now, few days later, you're sitting at home and you're discussing with someone. You're discussing with me. I take you back to that place mentally. You went to the dump yard, so much garbage. When you start thinking about it itself, you get that dirty kind of a sensation in your chest. You have that nausea, you have that heartburn, a sense of puking.
Correct.
So so this happens to all of us also without chemotherapy also. So when you think about when you go to unpleasant things, places, or when you think about those unpleasant situations, nausea or vomiting is triggered, even if you have not gone there. Same way. So when you say you have so same for a patient. A patient has taken chemo, usually the vomiting start if they don't take all precautions like anti-emetic pills and all that or injections, same day it will start. But now we have got so many medicines, we pre-medicate means before the chemotherapy we give these medicines so that they don't develop. If you give only chemo, don't give any vomiting medicines, anti-vomiting medicines, they will go home and they'll start puking or they'll start puking there only. Now for a person who has had these kind of experiences, when they come for the second cycle, right, when they come to the hospital itself, they will start vomiting because the whole thing comes as a flashback. Oh my God, I came here, they gave me this chemo, I started vomiting, I had such a bad experience. That gives them that nausea. So if you give adequate pre-medication, at the time of administration, you should not have vomiting ideally, unless it's a flashback phenomenon. Or it's a very highly hematogenic drug, or some people are exquisitely sensitive. They may have gastritis also, because of which they may vomit. Otherwise, vomiting usually happens after you go home within the first 2-3 days or 3 to 7 days. Or that nausea sensation is there for the first 3 to 7 days. Second week, you are better. Third week, you are much better. Patients say, we are much better. We started eating well. Now, again, you have called me for chemo in 21 days. So, you have to understand that if you don't pre medicate properly, highly hematogenic means proper pre-medication is required. Very low means you need not pre-medicate. So there are very strict guidelines for this. If you don't give pre-medication, patients will end up with vomiting then and there or very soon after the chemotherapy. If you pre-medicate well, nausea vomiting is usually there the first 3 to 7 days and then subsides and then perfectly fine in the third week. Flashback phenomenon is because you tend to recollect those memories and you have a feeling. That has nothing to got to do with your chemotherapy. There you have to reduce the anxiety, allay the person, tell them that, hey, come on, you'll be okay. That will help there. So all vomiting during or before chemotherapy doesn't mean it is due to chemotherapy. Sometimes it is psychological also, which needs attention.
Who would be more at a risk of developing the CINV?
Anybody who's on a highly emetogenic regimen, anybody who has gut issues like gastritis, women generally more than men, they say, somebody who's extremely anxious, somebody who takes a lot of painkillers which can lead to gastritis, somebody who doesn't take pre-medications or just takes it for one day and not the entire course. You usually take a pre-medication course for 3 to 4 days. Somebody who doesn't time the pre-medication properly. You need to take your anti-vomiting pills before food. Some people take it just before food, 5 minutes before. You should take it at least half an hour before. Some people take it after the food. Then how will it help? You'll vomit. So proper pre-medication, proper duration of pre-medication, proper timing of pre-medication, half an hour before food, pre-medication compulsory for your highly and moderately emetogenic drugs, avoiding gastritis, avoiding outside food, avoiding masala chaat items, home food, lot of liquids to drink, small frequent meals. All this helps you to reduce your anxiety and stress levels. This prevents CINV.
So, what are the risks if CINV is not well controlled in a patient?
What will happen? Imagine you're vomiting forever. Whole day you're vomiting. What will happen? You become dehydrated. You will lose a lot of potassium. Okay. Your blood pressures will fall. So hypotension, dehydration, hypokalemia, blood pressure falling, you're an altered sensorium.
What are the standard medications which are used to prevent CINV?
So broadly, we have 3, 4 medications. One is 5-HT3 receptor antagonist, we say. There is one chemical, you block it. Your common names are ondansetron, granisetron, we say, commonly called as Zofar in medical shops or in medical pharmacies. Then you have NK1 receptor antagonist. We call it as aprepitant. That is for highly emetogenic. Then you have steroids, the dexamethasone, which we give for 3 days. Okay, so you give steroids and ondansetron. Highly emetogenic, you also add aprepitant. And if it's still continuing beyond 3, 4 days, sometimes you add a drug called olanzapine so that the nausea and vomiting tendencies come down. And putting it very simply, because this is too much of pharmacology, which lay people will not understand.
So, how effective are these current antiemetic regimens which are being used?
Excellent. Excellent. They have reduced vomiting and nausea because of chemotherapy by more than 60 to 80%. Earlier, it used to be so painful for the patient. Now, with NK1 receptor antagonist, which is aprepitant, aprepitant, I'll talk more about the drug. So, they are very effective. Now, aprepitant comes as a kit. It's like a book. You have to open the drug. 125 milligram on day 1, 80 milligram on day 2, 80 milligram on day 3. It will be written like this. Open that. There will be 3 capsules. 125 milligram day 1, 80 day 2, 80 day 3. Fosaprepitant is an injection given before. Zofar or ondansetron is an injection or a tablet. Perinom, which is for vomiting, again it's an injection or a tablet. Dexamethasone is usually given as a tablet. It's a steroid. So we are worried, are steroids? No, steroids are given only for 3 days. Yes, even that in moderate or low emetogenic, we don't give steroids because there may be a small chance of infection or high sugars in diabetic patients. So there we try to avoid the dexamethasone. So steroids also have an anti-vomiting effect. That is what the layman should understand. But you should not keep popping it. It's only for 3 days if your doctor recommends it, and it is for a highly emetogenic regimen.
So, sir, you have spoken about how these medications can be used to prevent CINV. As such, do these medications themselves cause any side effects in the patient?
Yeah, you can, right? Perinom can cause extrapyramidal side effects. We say that. That is, patient can have, some neurological issues. Ondansetron can cause constipation. Steroids, if you use it or misuse it, you can develop hyperglycemia, hypertension. Your face can get puffed up. Steroid faces, we say, infection risk and all that.
So, sir, when you talk about CINV, you have spoken about the drugs which you are giving priorly before starting the chemotherapy. There are certain medications which need to be taken for 3 to 4 days after the chemotherapy as well. And then, sir, are there any medications which are given for a longer period of time, like not encircling the chemotherapy cycle? Are they given to the patients to be taken at maybe at home for a longer period of time?
This
Any conditions which require that?
post chemotherapy, we give this ondansetron for 3 days, or domperidone or perinom for 3 days. Metoclopramide, we say. Steroids are given for 2 days. Pantoprazole or any of the antacids can be given for 3 to 5 days to prevent gastritis. That's all.
Okay. So we'll go on to the myth busting part of the session. So, sir, the first one is that nausea and vomiting are inevitable with chemotherapy.
No, many chemos or targeted therapies, newer medicines don't cause, but uh, uh, don't cause it. So, and not at all. So, the bottom line is if you are very low risk or intermediate risk medications, if you're given those, they may not even cause nausea and vomiting.
The second one is that if I don't vomit, I don't need to mention my nausea to the doctor.
No, you have to mention, right? The nausea may be so bothersome that it may probably sometimes interfere with your food habits and all that, right? Mention it to the doctor. It may not be severe, but at least tell them. Probably if they are using a low anti-vomiting medicines, they can slightly hike it up so that even that nausea is not there for you.
The third one is that if I've had nausea and vomiting during the first cycle, I will have it every cycle of the chemotherapy session.
No. In fact, people probably get better with chemotherapy cycles because they know what's happening in them.
Okay. So, nausea and vomiting can happen only on the day of the chemotherapy.
No. It can happen even after that. It can happen many days after that. That's why you're given post prescription drugs, that is post chemotherapy drugs for 3-4 days, so that you don't develop.
The fourth one is that only IV chemotherapy can cause nausea. Oral chemotherapy pills will not cause.
No, oral can cause, oral cyclophosphamide can cause, oral melphalan can cause, oral etoposide can cause. So IV versus oral, yes, IV goes faster into the blood, but oral also can cause.
Okay. So the last one is that if I vomit, it means that the chemo didn't stay in my body.
No, that's not the point. You're vomiting food contents, not chemotherapy.
So would you like to summarize this session for us?
So CINV is a very important practical problem for our patients. But today's cancer patients need not be worried. You have excellent anti-emetic drugs, anti-vomiting drugs. Your doctors will give it as pre-medication before your chemo and even post-chemotherapy as tablets. So what I would say is don't worry. Be aware. If it happens once doesn't mean it's going to happen again. Take your medicines properly, pre-medicate yourself, and after that also the 3 to 5 days course completed. Take small frequent meals, don't skip meals and develop gastritis. Don't take too many painkillers which can cause gastritis. Take up antacid tablets if your doctor suggests so. Lots of liquids, green vegetables, fruits is extremely important. Small frequent feeds is extremely important. Don't be too anxious and don't think about CINV, and you'll be fine.
So would you like to enlighten the audience about the second opinion campaign which you're running?
On Cancer Reach, we have a second opinion campaign. Please reach out to us with your reports. We'll get back to you within 24 to 48 hours. It's free of cost. And the aim is only to guide you for better cancer treatment wherever you are.
Thank you for taking the time out to explain about chemotherapy-induced nausea and vomiting in today's session, sir. And we hope to see you again next Friday with another interesting topic. Thank you,
Thank you
sir.
so much. Thank you. Bye.